And good evening, everyone, and welcome to Health and Education April edition. And the first order of business tonight is to approve the minutes, and I need a motion to do so, please.
So moved.
Mr. Cook, Mr. Turner, thank you for the second. All in favor, please, if there's no discussion, please say aye. Aye. And opposed, there is none. Community care, Mr. King is with us this evening. And good evening, Mr. King.
Good evening, Mr. King.
I bet things were good at community care. You have the report there on your electronic device, since I have no idea what the thing is called, iPad, I guess. Beautiful report anyway. Anyway, you've read it, and Mr. King is with us. Mr. King, I want to tell you before you get started, I don't get to see you, but my mother-in-law, of course, spent considerable time at your place, and we've been out, and we had a meeting out there, and Christmas trees and so forth were in abundance, and Ms. Cook kind of took a little tour there and of the new construction, which is now done, and thoroughly enjoyed it. You got a wonderful, I think, very functional, efficient facility.
Thank you.
So I just tell you that. What do you have? I know you have no amendments particularly, but you do have your report, so take it away.
A couple of items on this report I want to make you aware of. As this is a county building, we had a roof leak, as I think the school system had 3 or 4 buildings that had roof leaks, the flat roof, and it has been repaired. Thus far, it has not shown any problems. We submitted a bill for our emergency time that we had to put in to get it repaired before the warranty people could get there, and they did reimburse us for that. Regarding a budget item for next year, there will not be a request from the county for anything next year for a capital item. So just wanted to make you aware of that. And something that's not on this report that is a county issue, we've developed a sinkhole out at the facility, and Eric Hill's office with engineering has already been out to look at it today, and they'll be helping us mitigate that issue.
Where is it?
It's in the easement area toward the Maples family farm.
Okay.
So it's not close to a building or anything?
No,
like
not a
that?
long way away from a building, but there is a sinkhole. We found it mowing, and called them out there, and it's pretty good size and pretty deep already. We're flagging it off, but just make you aware, land's doing funny things around here.
Well, if you live in Middle Tennessee, you probably got a sinkhole or have one at some point.
Yes, sir.
Anything else?
No, sir, not with the report.
Okay, we need to approve his report, of course. Let's have a minute for questions. Ms. Cook.
The compliance officer job, it's a job too. Mr. White's doing a very good job on that. And so,
It's a federal and state requirement to have a corporate compliance officer,
Mhm.
and that's something we've implemented, and it's working well.
Are you worried, Mark? You mentioned that the repair was holding so far. Is there concern that that's just a temporary type deal?
No,
until...
they did a major
Okay.
repair on it.
Okay, I just didn't want to know if I was reading too much into that, or if there was
It's a
concern.
25-year warranty, and
Okay.
it's been on about 12 years.
Okay,
Just wanted to
yeah,
give a
about
heads
halfway
up.
through. Okay,
so moved.
thank you.
Ms. Cook has moved to approve the report. Need a second?
Second.
Mr. Soriano, thank you so much. Any further discussion or questions? I think Mr. King has got something else he wants to discuss, at least. If there is none, all in favor of approving the report, please say aye.
Aye.
Aye, and opposed, and there is none. Mr. King?
I think this probably will be the last time I officially see you before you step out of the commission responsibility, and I just wanted to thank you for your work and for your support of the nursing home.
Well, I appreciate that very much, Mr. King, but I think that I think we can spread that around to 21 commissioners.
No question, but you've shared an important commitment.
Well, you're very kind. I appreciate you saying that.
He's important people, wasn't he, too?
And is this a door prize?
No. You leave.
Nice try.
Something happens to me, nobody cares, but if that goes, then somebody's in trouble.
The IT guys will tap you.
Thank you, Mr. King.
Thank
Thank
you.
you, Mark.
Appreciate it very much. Ms. Garrett, come forward if you would, please, for Health Department report. And I believe we're gonna look at your
Thank you.
budget this evening, I believe, as well,
Yes,
are we
sir.
not?
Yes, sir.
You have something to hand out, or you?
No, those were just
Okay.
my copies,
All right,
because sometimes
all
I
right,
can't get
righty.
my iPad to cooperate, so I want to have it in paper as well. So we have kind of a new system that we're submitting things. So I want to see if y'all got everything on here. Yes, you did, okay. The first, we didn't get together last month, so I brought February and March's report. So that's document 2 and 3 for you to review. And you can see we're doing really good on our prevention, lots of classes, lots of education that we've done to try to prevent things, and as well as having lots of encounters, patient visits for improving health when there's already a health issue. The protect column that lists all the things like our environmental inspections, immunizations, STD control, TB control. Those are things that we do to try to protect the community. So we've tried to tie our report back into our mission of protect, promote, and improve the health of the citizens of Rutherford County.
Maybe if there's any questions, please speak right up.
I know we don't have it on here, but do you ever compare the same month to the prior year?
Yes, we were doing that on the last report. And I look at that myself, but I don't know, I didn't feel like it
As
was
meaningful?
Yeah, as meaningful, but I can bring it because I do look at that every month as well. I was just trying to condense it to a one-page.
No, I like it. It's
Yeah.
much better looking. I was just
Yeah.
curious if you ever look at that.
Mhm.
So then if
Yes,
you see
ma'am.
something, just flag it for us.
Okay, yeah,
Yes.
exactly.
Yeah.
And I look for trends and you know, I kind of know that, you know, June, July, August are going to be increasing child health stuff. So we're getting the people ready for school,
Okay.
you know, the shots and all that. You know, you can sort of pick up on trends and you can see the difference from year to year.
Mhm. Good question.
Is that primary prevention number for the month about where you thought we might start ending up, or is it still too early to tell really where those types of visits might fall as
Yeah,
far as?
the primary prevention projects that we're doing, they kind of cycle because we'll do a big one,
Mhm.
like the Mayor's Law.
Yeah.
And so we'll have a whole lot of PPI, we
Right.
call it our primary prevention. And then we'll start planning the next one, and then so it'll be a dip for a little while.
Mhm.
But yeah, we had a really great Mayor's Walk. And just to refresh y'all's memory on that, we started that initiative last year, and that is, we know that around 30% of our residents self-report that they're not very active. They don't do any kind of leisure activity. And we know that if they're active, they're more likely to be less obese and more healthy. And so we want to try to encourage people to become more active. So we decided to pick out a good, easy, free walking space in each of your districts and have a walk there. And those are being converted into maps that will be online and also paper. So people can go back to our website here at the county, the health department. The hospital is helping us do that. They have contracted a company to do the maps. So it's really been a great initiative getting out and just showing people in their own communities where they can walk for free and leading the walks, you know. And I know some of you have come out and gotten to participate in those, and the mayors come to all of them and invite the city mayors and just try to get as many people out and walking.
Sure.
And showing them that you don't necessarily need a gym membership or anything. You can just walk in your own district. Right there.
Last month we walked.
Yes, Patterson.
Patterson's right.
Patterson was last month's district. And we have done 8 of the 21
Mhm.
districts, so we're making our way through them.
Right.
Yeah, slowly but surely. And June and July, we have 2 different ones scheduled. or getting them firmed up with the dates in Smyrna and Laverne. So those will be our first ones up there at that end of the county. And we're also focusing on, we're also focusing a lot on tobacco. You know, I brought the tobacco contracts to you guys where they've given us money. So that's been that will show up in April. We did a huge training where we're training all the staff in April and May, and opening that up to some community members as well on how to counsel patients who are pregnant and are smoking in a positive way that encourages them. It's called motivational interviewing techniques. So we've been working on training staff for that, and we'll start that initiative very soon as well.
Good.
Ms. Gary, did you want a separate vote on February and March, or are you okay?
I'm okay if y'all can.
Did you want to go over anything else in March or either
No,
month?
I was kind of going over both at the same time.
Mhm.
I just have one other question.
Sure.
And I know you probably explained this to us before, but under the promote, the tender care, what is
Yes.
the tender care?
Tender care originally came out of a state mandate that a lot of children who were on TennCare were not getting their well child exams and their immunizations. And so they said you must have some workers that do nothing except tell doctor's offices how and when to do well, educate them, as well as educate parents and children about well child exams. So we have a full-time director in that position, and then we have 3 part-time staff. And they literally get a list of children who are behind and go to each of their homes and remind them that they need to have their well child exams. So we went from somewhere when the program started in the mid-90s, being around 60 to 70% of children in Rutherford County. Now we're in the 99% of children, depending on the age group. It's a little bit harder to get those children that are like middle school because they don't need a lot of physicals. They don't need shots necessarily at those times. And so there's no coming into a doctor's office. So reminding parents that every year TennCare will pay for a totally free physical head-to-toe immunizations, and that's recommended for all children. So that's what that program is. And if you click on that little link, it just takes you to their website, tell you more about it.
Do you have a lot of homeless that come in?
Yes, ma'am, we have I would say a moderate amount, but it's not one of the necessary questions, but sometimes in just the data collection that we come up with, we discover that they're homeless. We work closely with Journey Home and kind of help with, and Greenhouse Ministries has done some great things. So we really are connected in our community to get them some resources.
I did share with her about the visiting the Journey Home.
He's the chairman of a homeless board.
Yes, I know. We talk regularly about that.
Would they get a flu shot, for instance? I mean,
Yes.
Seemed like that would be an obvious
If
thing.
you saw under, I think it was promotion, let's see, immunization other services, where it says 125, that is actually flu shots that we did at Journey Home. We partnered with St. Thomas Rutherford's Mobile Health Unit, and we went out there and offered those there. And then we also did them at Smyrna at a couple of places where they're underserved populations, the Burmese population that have a difficult time getting transportation. We worked with the schools there and figured out how the kids could get out of school and come and get flu shots. So that is something that we do as well.
Committee need a motion to approve both February and March reports.
So moved.
Commissioner Sheridan, thank you. A second?
Second.
Commissioner Allen, thank you.
Thank
Any further discussion? All in favor, please say aye.
Aye.
Gary, thank you very much. I know you have got
Yeah, I have one more good little piece of nice stuff I want to share before we get into the money. This was it's the last page, I think. Somehow it got attached to the last page. But a couple of our staff won a statewide award that it was for protection. And I thought I'd just share that with you. So every year during Public Health Week, which is the first week in April, they give out awards for people who are going above and beyond in meeting our mission. And you can see that they match, the awards match our mission. Excellence in protection, promotion, and improvement. And 2 years in a row, we got outstanding leadership in Rutherford County. Last year was our office manager, and the year before, I actually received that award. And then this year, we got 3 staff that received excellence in protection. And these are the ladies that do TB control and STD and communicable disease, foodborne outbreak. So you don't hear a lot about them. They're kind of the unsung heroes. They're doing a lot of the behind-the-scenes work, protecting our community. And so I was excited to see that they got some recognition. I just wanted to share that with you.
Read their names again, if you would, please.
Yeah, Yoncina Williams, she's a registered nurse that handles our TB control. Annie Eakes is one of our DIS, that's an abbreviation for Disease Intervention Specialist. And Angel Shoughton, also a Disease Intervention Specialist with our team there at the health department.
We'll send our congratulations right on. You have your budget is.
Yes, do you want to do this amendment to this current budget first?
Yes.
Okay, so that is, what document page?
Well, next to the last one.
Yeah, next to the last one, yes, sir. So in our new Smyrna edition, we had the sewer back up and it caused a major problem. While that was being repaired, that even though they called about digging and whatnot, when they started digging, they hit the gas line. And it was a really old gas line pipe that needed to be special ordered from another, it was really bad. So needless to say, we burned through our maintenance money very quickly. And so I needed to move some funds around, and that's where this request is coming from our other supplies and material to building maintenance to hopefully make us through the end of the year.
So moved.
Second.
Ms. Cook has moved we adopt this, and Commissioner Turner has seconded.
Budget.
I think we need to vote on this separately, do we not?
Yeah.
Yeah,
I'm just looking at this
we said it on the
amount
budget.
here, but I see what she's
Did
done
I
here.
do some?
Okay. Call the roll, please.
Commissioner Allen,
Aye.
Commissioner Cook,
Aye.
Commissioner Jordan,
Yes.
Commissioner Sereno,
Yes.
Commissioner Turner.
Yes.
Commissioner Jordan.
Yes. Okay, let's look at next year.
Okay. Okay, so the first, was that the first? No. The first one we have is the 55110, and this is the purely funded county budget that I have with you guys. In 2007 and 8, that budget year, it was a really bad year, and we needed to do lots of cuts, and I lost a full-time position at that time due to the budget cuts. And so we've been trying to put that in every year, and I've never really put it officially in there, just kind of trying to look and see, is there any way possible? So we decided to try to request a part-time administrative support person. In that, you'll see that 169, the third row down. That would be 20 hours a week. So it's the same pay grade that we lost in 2007-8. It's just not full-time, no benefits or anything, just the 20 hours a week. So this year as well, the state has provided us an extra LPN. They provided us a registered dietitian, and they provided us another registered nurse to help in our Smyrna site. So we have gotten other positions from the state, and also the higher paying positions came from the state, the registered dietitian and the nurse. Those are much higher than the administrative support. I'll tell you all that to say also, with the amount of requirements that the leadership team at our clinic is having to do, it's just impossible to do without some administrative support. We continue to do it, of course, but it is something that we've requested for a while and would like for you to consider. According to HR, 62% of the department heads have some kind of administrative support. So that's where I'm coming from with that request. The other requests that we have are, as you can see, the maintenance and repair. The Murfreesboro building is aging, which if you walk in, it doesn't look like it looks really nice, but there are things behind the scenes, the cooling unit and different things that are starting to age. And the Smyrna building was expanded, so maintenance on that's gonna be increased. The equipment is aging, and we had to get new equipment, so that'll have to be monitored. It has to be calibrated by a special company to make sure that it's accurate and working good. So those will go up slightly. We'll have more cleaning cost. It was just a tiny bit more. We actually just did the bid process, so it worked out that we made. We didn't know what the bid would go for, but we knew that we were asking to clean more, so we weren't sure. And it did go up just slightly, but not a lot. And then we have more biohazard pickup because we're seeing more patients in our Smyrna building. And then the expansion in the, causing probably an increase in the utilities is what we'll see after we've seen a full year with them. Everything else is, the only increases you'll see are the ones that are decided amongst for all county employees. You know, the insurance and the Social Security, you know, those kinds of things that are decided upon by you guys. That's the only other increases besides the ones I've written the notes on.
The other contracted services, you said you just got the contract in for the cleaning and it went up just a little bit.
Mm-hmm.
I noticed this was last updated a month ago.
Right.
And there's a $4,000 increase in that line. Is all that needed since that contract has come in better than you thought it would?
Right.
Which I know it's a small amount, and
Yeah,
a lot of
exactly.
department heads like to have a little line where they can draw something, but
Right.
looks like there may be $4,000 right there we could cut out.
Right, exactly. And there may very well be, in the contracted services, let me see where it's.
But it went from 56 to 60.
60, yes. Yeah, because we weren't exactly sure when we were doing this, and we
Mhm.
just had the meeting last week for the bid. So we do need to relook at that. Because we're estimating on that when we do this. And that may be part of the mayor's recommendations when we do that part.
So the mayor hasn't looked over this yet?
Yes,
Oh, yeah, okay,
yeah.
but that was
Right.
March 19th.
Right, exactly. We met, Ms. Nolan and the mayor and myself.
This employee,
Yes, sir.
that's 20 hours a week, starting in July. And we're restoring half a position that was cut when?
2007-8.
13,000 for the year.
Yes.
Just asking, does this person work 4 hours every day? Is that your?
That was the thought,
think what
yes.
happened?
4 hours a day, 5 days a week was the plan.
Okay, thank you.
Good worker, you put a lot of work in on that.
Yeah. Absolutely.
We have grown, well, you're seeing a lot more people than you saw in 2007, 2008. I mean, we're about to talk to the director of schools here, and we've gained 10,000 students since 2000, I guess, something like that in that neighborhood, and that cannot help but cause increased cost. I don't see how we can possibly think otherwise. I mean, might argue about the amount or something, but I don't,
Right.
you know.
Of
That
course,
was
a
the,
good bit of this budget is from the state, which is the next one
Exactly.
we'll look at, and there's
Right.
probably been growth in that budget
Yeah.
since 2007.
yeah,
So-
yeah, they've added several
Mhm.
higher paying positions.
But if an administrative person can free up those higher paying people,
Right.
don't it make sense to have somebody there, and they're not in there doing,
Right.
I don't mean to say menial work, but something that somebody else could do, and they need to be attending to patients or
Yes, sir.
people. And that would look like they ought to be doing that instead of the
Right.
paperwork if somebody
Yes,
else
sir.
can.
Yes, sir. And also, not only caring for the patients, but it cuts down on your cost per RVU, which is our rate we sort of look at. How much does it cost to see a patient for
Mhm.
one? And if those people are doing paperwork and not seeing patients, then it's costing more for them to be working there as well, the higher paid salary. So it really does balance it out to some degree.
I don't believe that Mayor Burgess mentioned this to me, but I believe Ms. Nolan mentioned this to me, that you had already talked with him, you just said that you
Yes,
had,
sir.
and that you were in general agreement, and he was in general agreement with your budget, is that correct?
Yes, sir. Yes, sir.
Okay.
In the past, when we've reviewed these, haven't we typically already had the mayor's recommendation by then? I was thinking when we saw it in the past, we usually had his thoughts as we were looking at it.
And it may be my fault. Maybe I sent the
No,
wrong one in.
no, I don't think it is. I think last month when we looked at one, I thought to myself then, and I just didn't ask it then,
Yeah.
but I thought we usually had his recommendations by the time we looked
So
at
you
it.
said the mayor has looked at this.
Yes,
Right,
sir.
So this is his recommendation.
Right, but there's a column there for the mayor recommendations, and usually he has a number there too.
Too, yeah,
So I'm just asking. I didn't
Yeah.
know at what point we'll see that box filled in.
yeah. And I can ask Ms. Nolan and
Okay. Well, that's why I asked the question publicly. I wanted on record that Mr. Burgess has, I believe that he has. I think Ms. Nolan told me that they had gone over the budget, both of them,
Right.
with you.
Right.
And that they were y'all were in agreement.
yes.
And
Yeah.
The fact that he hasn't checked it doesn't really, I'm okay with that, but I understand that.
Yeah, but I'll be glad to bring it, back when it has his columns on there, if that's what y'all
But it
would
wasn't
feel
just
better.
you. I'm just
Right.
saying, I just didn't ask it the last time I saw it.
Okay.
Because he doesn't enter that, our office
Yeah.
enters.
Yeah.
So, okay. And what
that's
point
what
do you
I'm
get that from him?
He'll probably adjust it again before the end of the fiscal year. I would have
Okay.
thought it would have been on there by now, but.
Okay.
And maybe Mark or somebody had it, and I just, right,
Yeah, we've
I
got-
didn't get it, the information from Mark,
Mark
maybe.
learning the system this year, so he may not have realized if there wasn't, if the mayor didn't make a change, he may well just not put anything down right
Gotcha.
there.
It's just helpful to see.
Yeah,
that
oh
everybody's
yeah,
on the
I
same
agree,
page.
I
Yeah.
agree.
If there are further questions from Ms. Garrett about any budget line item, now would be a wonderful time to say something. Otherwise, I need a motion to,
I was gonna make a motion to approve with line 399, move to 56,000. That's a $4,000 savings, it's not huge, but $4,000 is $4,000, it's taxpayer money.
okay, you heard
Absolutely.
Commissioner Jordan's amendment. Is there a second? Second,
Second.
Mr. Turner?
Okay, now I have a question. Can we take it all the way back to 56 and still do, because you expected it to go up some.
Right,
Do
just
we
was
need
a
to just,
little bit more biohazard.
is the 56 going to cover that? I mean, can we
Yeah, I
take
was
the whole
looking at-
4,000
I was
down?
looking at actual 6 months and thinking it was a year, it was paid out once a year, so, but,
We try to do, a lot of those are paid, contracted right at the beginning.
yeah.
So we do try to do those, but sometimes there's something that comes up that we need to contract for. Like we had to buy a few more rugs, contracted rugs, those non-slip rugs by the door and things like
So
that.
will you be okay at the 56 if we just have to do internal transfers?
Yeah, I think so.
Okay.
I think so.
And you might look at it a little bit before it gets to budget.
I will.
I
just
happen to have the
double.
luxury of being on,
Yeah,
luxury,
you're
but
gonna
I'm
see
on
me
budget,
again,
so
yeah.
if you
You're
come
gonna
back
see me
at the
again.
budget time and say that's a little short, I'd be happy to try and help get it back to
Yeah.
57 or 8 or if it
Okay,
needs to. but,
perfect,
you know,
perfect.
but
Okay.
Okay,
Thank
we have a
you.
motion
Appreciate it.
to approve 56,000 for that line item, and it's been seconded. Any further questions? Need to call a roll on that? You do, don't you?
We can do it either way.
Let's call a roll on the budget amendment.
Tanya, can I get your paper copies?
Sure.
Do you need those?
Yeah, no, I'll give them to you.
Commissioner Allen?
Aye.
Commissioner Cook?
Yes.
Commissioner Jordan?
yes,
Commissioner Sereno?
Yes.
Commissioner Turner?
Yes.
Commissioner Jordan?
Yes, need a motion, if there are no further questions on the regular budget, to approve, and a second?
I thought my motion was to approve it with
Oh.
that change.
Oh, my fault.
That's the way
exactly right.
the way I thought I voiced
You
it.
approved it, changing.
Well, it's good we voted then, isn't it?
Yeah.
That is correct, and that was exactly his motion, so we're in good shape.
Perfect.
All right. Anything else, Ms. Garrett?
No, sir, not on that one. The next one is 55160. Where'd it go? there, it got stuck to the last one. 55160 is our dental program, and this is fully funded by the county as well, and we're not asking for any increase there.
I'm gonna predict in advance that we approve this.
It's an easy enough motion to approve.
There's a motion
questions
for
there.
Commissioner Allen, a second.
So,
Ms. Cook, thank you. Any discussion? Anybody want to raise the dental amount or anything? If not, call the roll, please.
Commissioner Allen?
Aye.
Commissioner Cook?
yes.
Commissioner Jordan?
Yes.
Commissioner Sereno?
Yes.
Commissioner Turner?
Yes.
Commissioner Jordan?
Yes.
Okay, and the last one is 55190, other health services. This is the one that's fully funded by the state as a reimbursement to the county. And so the only increases we put in are just the estimated increases that will come along with just any county employee.
Motion to approve as presented.
Second.
Thank you, Commissioner Jordan. Commissioner Soriano seconded. Any discussion, questions? Call the roll, please.
Commissioner Allen?
Aye.
Commissioner Cook?
Aye.
Commissioner Jordan?
Yes.
Commissioner Sereno?
Yes.
Commissioner Turner?
Yes.
Commissioner Jordan?
Yes.
Okay, that's all I have. You need all the money?
Everything if you
Or
can.
all of it? Well, I think I'll remember that. That's what I know. Oh, one more announcement. I just saw my notes, sorry. If I may, May 15th is my Board of Health meeting that I have with my board, so I always invite you guys.
May
It's
15th.
It's at lunch, 12 to 1 at the Health Department in Murfreesboro. So please don't feel obligated, but I wanted to let you know if you were free and you wanted to come. And we were, the health rankings were released this past month as well for the county health rankings, and Rutherford County again placed second healthiest county in the state of Tennessee. So that's something to be proud of, that we're doing a lot of things good. We do have to look at it in perspective, because Tennessee as a whole is, in the 40s as far as the state's healthy. But of the counties in the state of Tennessee, Rutherford is second for the third year in a row. So
Who's first?
Williamson.
Williamson.
Yeah. So I
I get
plan.
tired of Williamson County.
I've been working on a report with.
I suspect they're sending us sick people over there.
Yeah, I think so.
They're moving to Triune and coming this way.
Yeah.
I've been working on a report that I hope to present to you guys maybe in June or July that will show the comparison and where we need to go to get to number one. What kind of things would we need to improve on, what areas.
Promote more Krispy Kremes than Cool Springs.
Franchise.
Take them down, tell them they come up.
I know you may be.
Smoking was a big one that stand out. We had 17% reporting smoking, and they had 10%. So that's a big one there that we have to work on.
You
Yeah.
might want to do a comment at our comments sometime on the well-being of our county health.
Yeah.
I'm sure you'd have more than 3 minutes if you wanted.
Yeah, sometimes it's hard. I'm sure they're going, hurry up, hurry up.
I do have on the tobacco part that you were just mentioning.
Yeah, yeah.
Do you have any idea yet what these new vapor electronic cigarettes, whatever they are gonna, how that's gonna change things? Because I know several people who've already stopped smoking using them.
Yeah. They are not a safe alternative to smoking, though. They are still very dangerous. They're unregulated. And they are, matter of fact, our Commissioner of Health is so worried that he did a public health advisory warning, which we haven't done in years, against them because, and I'll be glad to email that out to you so you can have it.
Yeah,
There's
please
my
do
notes
that.
again.
That would be helpful.
So, yeah, I will email that out to you because I've sent it to the press and up to the mayor, but I forgot to send it to you guys, so I will. But it is a really alarming trend that we're seeing, especially our teens. They think they're really cool. You can get them in all kinds of flavors, vanilla and, all these different things. And so they're thinking that this is a cool alternative, and it won't hurt me like
It sounds
smoking
safe.
will.
On the
It-
surface, it sounds.
It does, and,
Yeah.
and you know, the tobacco industry spends a lot of money advertising and convincing us things are safer, like light cigarettes or ultra cigarettes or filter, but they all still have thousands of chemicals inside
So the
of
tobacco
them.
industry is behind these vapor cigarettes as well?
Yes, yes. A lot of them are, you put nicotine into them.
Okay.
It's just not the tar or smoke that's coming out, but they're still using the nicotine in there.
Okay.
And then they're adding flavors, and they can put all kinds of things in there.
Hmm.
But these stores are definitely popping up a lot of places.
So
and
they
it's-
really haven't technically stopped smoking?
No, not really.
Yeah, when you're
There's
thinking
something-
about.
Something in their lungs, we don't know what it's gonna do.
Yeah.
Right, we
Yeah.
don't know.
I'm just
but
thinking
we-
about the nicotine part. I mean,
Yeah,
that's the
the-
part that's dangerous, right?
Right, the nicotine is the addictive
Yeah,
part,
yeah.
and it has a lot of different chemicals, so
Mhm.
it is, I think there's a lot of false understanding
Mhm.
about them out there, so I think that's a great question, I'm glad you brought it up, because it is something that we're trying to get the word out, especially to the youth, you know, we really don't want them thinking, hey, this, I know cigarettes are bad, but I'm gonna try this because it's cool, and, you know, those kinds of things.
We
So
don't
then
know
what-
the side effects, and we don't know, there's gotta be secondary smoke to this too, which has been proven with regular tobacco products to be almost as deadly. And, we don't know any of that, do we?
We don't know. It's all very new and unstudied, and
Mhm.
we just don't know. But we know that there's a lot of chemicals. We do know what is in some of them, and a lot of them are still having a ton of chemicals.
So when
And then
the-
people are also wanting to use them in restaurants and
Mhm.
buildings and doctors' offices because they don't think that it's,
Right.
you know, secondhand smoke, so it's not a concern.
Mhm.
So that is something that, again, our commissioners going to the state legislator to try to say, we need to make this part of the law, the Smoker Protection Act, the Non-Smoker Protection Act that is out there and protects people who are non-smoking.
So as you guys track the tobacco use, how will you factor that in?
That's definitely something that we're looking at. Even the questionnaires and things that have been studied and proven to be good assessment of a person's health, they don't ask those questions because
Didn't
when
exist,
these were
yeah.
studied, that wasn't, you know, no one knew about these things, you know, so they've just really exploded on the market and come out. So we gotta be aware that we don't know what we don't know,
Gotcha.
you know, about them.
Ms. Carey, thank you.
Thank you, guys.
Appreciate it very much.
Appreciate
Thank you.
Ms. Jolly? Come on up if you would, please. Special projects report. George Creek High School is completed. It says so right here.
Does it say that?
Well, it says 100%, that's all of it.
Construction complete, right?
Oh, well, you're right.
But we haven't spent all the money yet.
After I did my report, of course, something came in. We had requested from the town of Smyrna for them to reimburse us for the mixed drink tax, and that money came in. It was $539,519, and that's gonna go towards the Smyrna primary.
They paid it in full?
Mhm.
All at once, one check.
That's what
I guess
happens
that's
when your
all of
former
it.
school superintendent.
You would think we'd have pretty good leverage toward the city manager.
Excellent point.
Good logic, okay.
So that helped
That's awesome.
quite a bit. That if you it's on the page 5. That's where that figure is went now. That we have $624,519 in money for that. And I have nothing else to point out unless you just have any
Okay.
questions.
And that construction is looking great, by the way. I go by it every day, so. And occupancy will be when? Do you think it'll be in time for August or no?
I think it'll be.
Okay, yeah.
How much was that money?
$539,519.
Excuse me, Commissioner Allen, what, you asked about which one? Which can?
Oh, the Smyrna primary.
Smyrna primary?
Yeah, they said occupancy would be by August.
We're gonna make that. Blackman, probably not.
Mr. Clardy said it was, this last couple of weeks, you really begin to see a turnaround. That's one still, that you coming out of the ground.
If anybody can make it happen, Mr. Clardy and his staff can. They've always come through for us in
I
the
don't believe
past.
it's ever been late, Ed. I don't think we've ever. Any questions for Ms. Jolly on her, as always, excellent report?
Make a motion to approve the report as
Thank you,
presented.
Commissioner Turner.
Second.
A second. Don't have to call the roll on this one, do we? All in favor, please say aye if there are no further questions. Aye, and opposed, there is none. Ms. Jolly, thank you. Always great to see you. Director Odom, please come on up, and Mr. Sandvik, please join us. First order of business here, we have some amendments, and I believe you have all those, and I believe we can do these all together. I don't, but if there's a problem,
The
no.
last one is a separate fund.
The last one's a separate fund, you have to explain that in a little bit more detail too, don't you?
Yes, sir.
Okay, let's take, what are the 6? Is that right?
It is.
There's 6
6
of them? All right.
GPS.
Okay, let's take the first 5 all together, and committee, if you have questions, just interrupt, and gentlemen?
This is the cleanup time, of course, of the year. You know, you estimate your budget a year away, and so we're now in a situation of revenues change, donations change, people change their insurance, that sort of thing. So we're at the time of year that you're going to see a series of these over the next couple of months, and so that's what that is. But we'll be glad to try to answer any question that you might have on any one of those.
Okay.
You want to read them? You want to do that?
The motion, and if there's an explanation, yes, sir.
Okay. The motion on the A is to amend general purpose school fund budget by reducing $145,654 in state revenues for the career ladder account 46610 and extended contract programs account 46612, and reducing budgeted expenditures by the same $145,654 as presented. Career ladder started in the mid-'80s, if you remember, and as people retire and all, that's changing now.
Now gone, and if there are no questions, go ahead with B.
Okay. B is to amend the general purpose school fund budget by a total of $429,284 in already budgeted teacher pay, $391,265 in related benefits of $38,19 as presented.
And if I may point out one thing on that, that is 0.25% of our teacher budget. Even though it's a lot of dollars, it is a small amendment.
Okay.
C is to amend the general purpose school fund budget by a total of $270,665 in already budgeted employee medical insurance and life insurance expenditures as presented.
Go ahead, Joe.
Okay. And then D, to amend miscellaneous revenue accounts in the general purpose school fund budget by a net increase of $118,461 as presented, and to amend the related $118,461 in related expenditures as presented. Of course, that's on your spreadsheet that you have the other, that you have copies of. Okay, the donations, to amend donations and contribution revenues account 44,570 by $92,505, and adds $92,505 in related expenditures, and to amend $16,720 in materials and supplies from the coordinated school health budget to health equipment as presented. And the last one, adult education, to amend adult education revenues between state, a decrease of $27,515, and federal funds, an increase of $34,042, and budgets the expenditures for an additional $6,527 in federal funds awarded to the system as presented.
G is also GPS.
G is also GPS, the classified staff. And this one is to amend the general purpose school fund budget by a total of $252,068 in already budgeted classified staff pay, $209,965, and related benefits of $42,103 as presented.
I'm gonna save that last one for a minute or
Now,
two.
what's the second?
If there's any questions on any of these, they appear to be general housekeeping end of the year type things.
Just like Mr. Sandy said, the 0.25% or whatever was, what, $400,000 or more, and we're dealing with big numbers, you
Yeah.
know, and if you can get within a 0.25%, that's pretty good on a year ahead, so I'll make a motion to approve all these as presented.
Second.
Second from Commissioner Allen, I bet you won the race, Mrs. Soriano.
Okay, that's fine.
Call roll. Call roll.
Commissioner Allen?
Aye.
Commissioner Cook?
Aye.
Commissioner Jordan?
Yes.
Commissioner Sereno?
Yes.
Commissioner Turner?
Yes.
Commissioner Jordan?
Yes. Director Odom?
I believe is it about 83% of our budget or so is personnel?
It's just personnel and benefits, a bit over 80.
It's somewhere, so you're getting close to that. Okay, happens to be a chiller for Blackman Elementary. Of course, the time to replace it is expensive. To amend capital project fund by moving $41,520 from account 34,685 committed for capital projects in order to fund the balance of a $93,270 chiller replacement at Blackman Elementary School, account 91,300-335 as presented. They are expensive when they go down. You have a large
Total
building,
replacement.
you do.
In this case.
How old is that school? I still think of it as a new school, but it's probably 15 years old.
Look, it's in your,
It was here when I came on the commission. I've been here 12 years, so it was there longer than that.
Blackman
so.
Elementary will be in that. It's got the year that
Right.
we opened it. It's over in the year where it tells that. But you're about right.
And we did have a smaller chiller also go out, but we were able to cover.
It's towards the end.
Toward the end.
It's got all the schools marked in the list.
Time gets away, you know. when you
Yeah, I
think
know
of
it really does.
Yeah, this one.
And there's a page before that one even.
I know we bought some chillers for the sheriff's department. They were very expensive.
98.
98.
It's 16 years.
You know, and
Okay.
we mentioned,
98 for this again.
you mentioned earlier, one of our problems now is gonna be roofs again. We
Yeah.
had that especially at Thurman Francis where it cracked from one end to the other. Our asphalt and that sort of
I'm
thing.
looking at Barfield.
So that's our issue.
Blackman Elementary was 2001,
Well, there's right at the very top. Yeah.
so it's the 13,
13.
working on its 14th year, its 13th year.
15 years.
I wonder what the warranties say, I wonder. Life expectancy, I'm sure it hasn't run out already. 12.
Probably 12.
12, up to last month.
Yeah.
I know when you purchase your heat pumps at home, what the old Copelands that were all cast iron many years ago last much longer than ones you do now. They're different.
They all go out a month after the warranty.
Well designed.
Yeah.
Well, I think it's pretty obvious we're gonna have to replace it, so, but anyway, I need a motion to do that.
Motion to approve.
Mr. Turner, thank you. A second?
Second.
Mr. Soriano, thank you. Any further questions, discussion? If not, Ms. Shelton, just eager, call the roll again.
Commissioner Allen?
Aye.
Commissioner Cook?
Aye.
Commissioner Jordan?
Yes.
Commissioner Sereno?
Yes.
Commissioner Turner?
Yes.
Commissioner Jordan?
Yes. We have paperwork.
Yes, we do. We've got some to share with you.
Sure.
Oh, boy.
This is your midnight reading?
No, I don't think so. I think I'm supposed to start
Well, I
that.
think,
No, we didn't.
oh, Jeff
I
Phillips,
think
Commissioner Phillips.
that's my duty.
Okay.
Director of the always popular other business.
Okay.
So I know we're gonna at least take a
A glance
sort of
at
a
it.
look at next month, aren't we?
Some of it you're gonna find, you're gonna like, so we'll talk a little bit about that. You know, and I know it's the time of year that your constituents and and the people we serve ask us about the budget. So if you, this little short sheet that I give you, it has some colored graphs on it. It basically shows some information about Rutherford County, the per pupil expenditures. Over since 2007-8, we can go back further than that, but that you can basically see the gap between the Tennessee average and Rutherford County. This most recent year that's complete, it was $1,282. So that's mainly instructional programs and utilities. You know, and I really haven't asked Jeff this, but if you notice the gap is widening a little, and I'm not sure that it hasn't helped some because of course, we've gone more geothermal. We put in the savings with the electricity, the water, and that sort of thing. So I think we're beginning to see some paybacks on some of that because that's included in that. As you start seeing that, because we definitely have more students, but this bases it on a per student basis when you start looking at that. So I think some of that may be paying off. And of course, the graph at the bottom is a blue line of kind of our enrollment, basically, which we use mostly third month, and mainly what we use. So you can kind of see what's happening in enrollment. And I know you're well aware of that. I asked myself a second question on the second page, and again, as you talk to people and your constituents and all, my curiosity was, with inflation, where are we? What have we done in Rutherford County Schools? How good a job? This precedes me, you know, till now, and looking at that. And so I went back to 2001-2 report card, which is a little block on the left. And at that time, the total expenditures were $5,665 per pupil, and 42.7% would have been local monies. So if you look kind of at the right below the blue box, in 2001 or 2, Rutherford County was spending $2,419 per pupil. Basically, is what we spent in local monies out of that $5,000. Then it came to 12-13, which is the last year completed. Of the $8,010.68 per pupil of what the state said, and these are state documents, it's 39.04%. So did that, and so in 12-13 we spent locally $3,127. And let me just add a little footnote here. We talk about a growth and with our houses. I don't know what exactly it is. Lisa's not with us tonight, but probably the average house is $800 to $1,200 property tax. So it's extremely important that people in Rutherford County shop in Rutherford County because sales tax has to make up some of this difference. And of course, when you have lots of starter homes and you have that, and they have average 1.5 or 2 kids per household, and you're looking at $3,000 a piece, that's a long way from the property tax. Basically, and you've heard this before, growth basically by itself doesn't pay for itself. People want to say that, but it really doesn't. Because you've got ambulance service, you've got all of your sheriff's departments, you've got all of your other things tacked on top of this. So very, very tough. But anyway, just to let you know, and that you can say to your constituents, and you're part of this, helping us do it, if you actually do inflation-adjusted dollars from 2001, that 3,183 we would be spending if inflation adjusted. So we're actually spending $56 a student less inflation-adjusted with a cumulative inflation rate since 2001 of 31.6%. So $56 per student out of 41,000 students is about $2 million you save this year had we just spent inflation rate. So as you can tell, your constituents that together we are looking at the funds, I think, wisely. I really think so. And I think you probably could find much of the same thing in many of your other departments.
And the percentage of local money's gone down too, has it not?
It has.
It's gone from 42 to 39%, if I'm looking at that right?
Yeah. It has. We actually, and that varies a little bit. When you go back a few years back when the ARA funds came in, that was kind of those things that lasted 2 or 3 years. So that depends a lot on what's happening in federal funding. But overall, our federal funding has a tendency to have dropped over the years. And federal funding is mostly for your food lunch program. ROTC gets it. Title I receives that. Federal ones. Again, I said ROTC, didn't I? And the special education funds for that. So that's most of your federal. Right?
And the big shift we saw here, 2007, 2008 was the year we got the DEP2 money. Mm-hmm. So that our state funding level went up. Mm-hmm. so far,
Right.
since then.
Is that the reason for the discrepancy between the Rutherford County numbers and the, right below that where you've got the finance state of all Tennessee schools? This block right here? You've got how the money's paid out in Rutherford County, and then you've got the block of how it's paid out across the state. And so,
I did that to just let you see it.
Yeah, no, that's what
It comes off the state report card.
he was just saying the state funding was higher for us, and it is at 55%.
It went up.
Well, that would be the average in the state
Yeah.
column. If you look down there with a block with the state,
Right,
that would be what if you took all Tennessee school systems,
then there's
that's
just
what the average would be.
48, 47.
And we're close to that. If you notice that over the years, we're very close to the state average 40.10, you were 39.04. So we're very close to the state average, and local money's going towards.
No, I was just saying the state funding is higher for us, which I'm delighted to see. I'm happy to
Yes.
take as much money from the state as they want to
Yes.
give. I was just trying to figure out why
And the
it's.
federal
funds are
federal's
lower.
lower for us. I guess they have more free and reduced lunches in some of the,
You
More
did. We're about
poverty
we're
areas.
about 43% now,
Yeah.
and it's increasing about 1% a year. You can track back over the last decade or so, and you'll see for Rutherford County about 1%. Something hit my mind a few minutes ago. You were talking about the homeless figure. We have a little over 900 students in Rutherford County schools that are classified homeless under the Kenny Vento Act. So it's interesting for this year, and actually, I guess Ms. Snell comes and does that report.
She comes to the report.
I know some figures that jump out, and I'm not advocating anything for this month or next month either, or we can do that at all at the proper time, but I do think the public needs to hear. And I hear a lot of things very positive about our schools, and I think they're all well deserved. It says right here on this piece of paper that the Rutherford County per pupil last year was $8,011 per pupil, and the state of Tennessee was $9,300. I'm rounding both those figures.
$50 million.
Okay.
If you
We
actually.
have 41,000 students. It's hard to look at that any other way, but that we're getting tremendous.
he had a good point. Yeah, $50 million more if we spent the state average.
And I think you've got other departments in county government doing that. That's the point. I think we need to sell it to our people sometimes, because always, especially during election time, people say, you know, all of these things, and you've been doing a heck of a job. But, you know, I think we all have. We're taxpayers too.
That's right.
Regardless of what some politicians say, most of Rutherford County is run very well. I mean, this
It
is,
really is.
that's $50 million in savings right there in our school system from the state
Annually.
average. Annually, yeah, annually.
Annually.
Yeah.
Oh, and
Look at it.
I was looking at something today along these lines. In the years covered on this, and then this year, we have opened 6 new schools and additions on 6 other schools in this 7-year period because of the growth we've seen.
Yeah, but your capital expenditures aren't part of this.
No,
Yeah.
no.
This is
But they're not part of the
operating
state's either, so,
No, they do not.
Yeah.
They try to eat.
But you're paying
make
that.
them
I mean, you're doing,
Right.
there's no question.
right.
Well, I'll just say what I'm feeling. It's a source of constant annoyance to me that this is not publicized very well. And we look at our tremendous audience behind us here, of which there is no one, and nobody from any newspaper. But they are going to watch it on television. That'll be their way of covering it. Well, there's a good thing that they can cover right there. So feel free, Mr. Broden, to do that very thing tomorrow morning. Or
I
we
had
can
a
say-
gentleman today to tell me, he said, I'd like to know what the county does for Laverne. I said, we got 6 schools. Oh, I wanted something besides the schools. And he didn't know what to say when I said, well, county's furnishing 6 schools right here. And I didn't get any further than that. He wouldn't let me. And he has a business over in Interchange, over in Industry area, over in my area.
Well, we're straying here, and that's probably my fault. I'm the chairman. I'll have to take all the blame for that. But go ahead, Ms. Dolan. I know there's some things you'd like to at least introduce to us tonight
Right.
for next
I'm
month.
out defending you to the public myself. That you have a copy of the first basically budget we presented to the first draft to our school board. Tomorrow night, our school board will meet again. Remember at the first draft, when we were looking at this, the governor was talking about 2% raise for teachers and other things that are in there. Another thing that was said, even by some of our own representatives, was saying, well, the average teacher got $580, $500 to $800 to pay for their insurance. That's if you're on the state system. We didn't get any. Rutherford County is self-insured. So when the state offered to pay some, they only did it at the state level. So here's our dilemma next year. We grew 2.9% last year, roughly, in student population. We're going to be 2.9 to 3% this year. So as Jeff and I, we begin looking at this, if that growth is about the same. Our budget, we had $302 million, but $2 million of that was one-time money from the governor, if you remember, to do technology replacement. So we went back and said, $300 is kind of your base expenditure. That's a one-time expenditure. So 3% would be somewhere in the 309 to 310 million range. I mean, that's if you keep it at the same rate as your growth, as your student growth. This budget is 314 that you have in front of you by line items, but again, that was when the governor was including some things that we've taken out. The board will see a budget tomorrow night that'll be a little under 310 million. So they haven't approved it yet. We couldn't bring it up here, and actually they haven't seen it. And basically with 82 to 83% of our budget in personnel, folks, you know where a lot of it came from. And so we're back. We would love to be able to do for our teachers at least to pay the part of the insurance change for our employees. I don't know whether we can hold that or not. But basically there's not going to be much there as far as raises and that sort of stuff. Some teachers that get another year, and you know how that works, or something like that, or a degree change, there'll be some growth in that. But the other things that we're doing are basically looking at somewhere to stay in that 3% or so range. One of our problems in Rutherford County is where you have a pupil-teacher ratio in K through 3 of 1 to 20, or career and technical education is 1 to 20, 4 through 6 is 1 to 25, and you get for 7 through 12 is 1 to 30. An oversized class fine is $55,000 per class. It starts there, goes up to about $65,000 or $75,000. So you can't go there. I mean, you got to meet those class sizes. One of our problems is we go into a typical elementary school, and our ratios now will run 1 to 19.2 or 1 to 18.7 if it's in a 1 to 20 grade range. So it's not even when 20 more kids come in. You may have 8 kids come in, and if you've got 6 classes of that grade and 8 kids come in and you're at 19.1, you don't make it anymore. And so we do not have reserve capacity, is what I'm saying, and that's what I'm trying to explain to you. So not having reserve capacity, you begin to have to look sometimes at what's your worst case scenario and what you do. We move teachers. I was speaking to Mr. Zago, my instruction person. We were talking this week. We've already moved 5 teachers for next year from one place to another. We look at enrollment. We look at career and technical enrollment. If one's down in an area and one's up, we move teachers first. We move some this year. And then we come back and have to fill in to meet growth that we see. So you haven't had a chance to look at this. We'll try to answer any questions we can. There's at least 3 or 4 positions here that used to be federally funded are no longer. The psychologist.
7 of them.
We had to add one of the new nurse positions here. We had to add now under state law with certain procedures we must hire. So during the year we had to add another nurse to match that procedure. One thing we have been able to do in Rutherford County Schools, and this is very significant to us. About 4 or 5 years ago, 14% of our students were special education. With your help, we've been able to put in more interventions, try to catch kids earlier. We're working on that even more for next year. The last report card, we have a little over 11%. Now, 3% of 40,000 is 1,200 students less in special education. And that's the ones they're very expensive, very often, because of the level of intervention pupil-teacher ratio. So it tells me also that the interventions or things that we're doing, again, not only is the right thing to do about kids, but we've gotten better at it by picking up on this. And then a new thing coming down the pike, state's kind of initiating, and we're a part of it, is response to intervention squared. And what that really is, response to intervention, is being able to more quickly pick up students that are having difficulties, especially in their reading and math areas, and go ahead and build in the interventions. The old formula for special education, in the full federal government formula, you had to get one standard deviation in your performance away from your IQ back. You know, measure your IQ, and when you got one standard deviation away, lo and behold, you qualified. Well, that's not right. I mean, you don't need to wait till a kid gets there. Mm-hmm. And so the response to intervention will take students much quicker, being able to do the interventions and do that. So we're looking at some interventionists, some people to do that. Our professional learning communities are another thing that we put in place to do that, to try to address it collaborative among students. So we hope, we try to get better all the time, is what I'm saying. Our demographics are changing. You know, as I've said this before, we are the third largest ELL population in the state. As she mentioned, the Burma students a few minutes ago, we call them the Karen students. They were from Burma, been in Thailand. They come to us now. They're the Karen students, is basically what they are. And those are good kids. They're really not discipline problems and stuff like that. They haven't been in school in 4 and 5 years. Mm-hmm. And because of the time between Burma and this now, many of them are high school students by the time that we're getting them. But great kids. You love serving, but it's just the situation you got. So some of our population, the free reduced numbers, the population, the demographic changes that we have are a little bit more expensive than it was once upon a time. You know, I was with them at even where we're 43% free reduced. I think Wilson County is like 27, and Williamson County is less than 20, and stuff like that. So just bear in mind as your demographics change, it costs a little bit more to do the interventions, to be a high-performing school system, and do the right things about kids. So that's what we try to do. But anyway, I'll hush. You can look it over if something kind of stands out in your mind. But there will be another budget, which Jeff, I think, may want to tell you about. We talked about mail. We talked about today what you might do after they approve it.
After they approve it, if you'd like, I can mail copies to them.
Yes, please.
And then you won't see it for the first time in
Yeah,
May
that's
when
right.
we
Please
meet.
do
That's
that.
what we
And
don't
the
want you
May
to do.
version may change more depending
It's
on
revenue change.
Fine,
See what the state revenue comes
but
in.
it will be much closer to this one.
Yeah, that would be
Take
helpful.
You know, I was thinking when you were talking there about the growth, I was assistant principal at Laverne High School in the mid-90s. And Carol, you might help me out here just a little bit, but I believe we had Roy Walden, Laverne Primary, Cedar Grove, I think, was built at some point right in there. And Laverne High School, that's what we had. And they did a study of our student enrollments and whatever. And those 4 schools lost 4 students per week and gained 7 every week. Now, some weeks 9, some weeks 4, but I mean, and it just week after week after week after week, and you never knew where they were going to be, of course. And it turned out, I think, in those years, a lot of them went to Smyrna Primary. Am I right? I mean, a lot. And of course, you can see the growth down there. I mean, what we've built down there, and what we've expanded. And Laverne High School, I guess, well, there's no more land, is there, really, to build anything else? So.
The other piece on the revenue side, of course, it's tough for us this year. I mean, the state's not sending additional revenue other than if you earn a student, they'll give you their ADM share. Roughly, overall, teachers of all degrees and experience, about 48.5%, you used the other night, is local monies, I think, of a teacher. Sometimes in growth where you hire new teachers, you'll get more state monies, you know, if they're not degrees and all.
Good years.
The other piece is with the reassessment, if we adopt the certified tax rate, we grew 1,140 students last year, and if we grow that much again this next year, and we may not get any more property tax monies for that growth with certified tax rate. I mean, I know y'all know that. I'm not telling you anything you don't know. But that's what makes it so tough. So we're relying really, our growth is gonna be a lot of ever how well our sales tax have done this year. So that is the gap that we're gonna see, basically on our revenue side, is not being able to pick up something on that growth property tax unless we do something. I mean, it's just a reality to us.
I wanted to ask you too, the state, because you mentioned it twice now on the degree, additional degrees. The state decided not to implement that, didn't they? They're gonna pay for degrees?
They haven't really changed anything on that. The bill was that you could not use the value-added score to influence the teacher's licensure and that sort of thing, but they didn't change the others. So far as I know, all the others still pretty much in place.
So after a master's, no raise
The state's
unless
not
local.
recommending anything above that, yes, unless you do it locally.
Jeff, you mentioned mailing those budgets, being
Yes.
that is a joint budget, health and ed
Right.
meeting, you might want to mail to budget members also.
Okay.
That's just 6 more,
Okay.
and, but that way, they're gonna be expected to vote on it, and, they won't be looking at it first too.
Which, if you'll just stay with us just a minute too, and there may be more questions, I don't mean to cut that off at all. But just moving on to item 6 here for just a minute, remind the general public, remind everybody here, and I've talked to Ms. Ely about this, that our next meeting is May 27th. It's at the school board offices, and it is, and this is the big thing, 4:30, not 5:30.
It's a graduation.
4:30,
time stuff,
right.
I think.
There's a graduation that night, and the
May
director, beg pardon?
What date?
It's the 27th, and Mr. Jordan is looking
4:30.
at his book, and he's saying 27th, yes, 4:30. We did discuss this a couple of months ago, as you're aware. Director and staff want to go to, and it's out of town. It's in Williamson County, where they're very healthy, as we know.
You know,
Agriculture Center.
Beg pardon, yeah, at the Ag Center over there.
and our issue in the public, our principals, and we agonized over this, but in our typical graduation, we go to MTSU, and if you've been there, people don't sit right behind the stage, but gosh, they fill it all the way up to the other part. We'd have 7,000 and 8,000 people.
Right.
And we, when you start running 500 plus students in your graduating class, and they bring 12 apiece, and then kids want to come see each other and all. So we're down to when you look at our football fields, they see a little over 4,000. You think it's more than that, but it's not. A little over 4,000, and part of them are on the visitor side, which have been on the wrong side. We even checked on the Miller Coliseum. It's with chairs and everything. It's in the 4,000 to 5,000 range. So we either issued tickets to get in, or you try to go somewhere where you can get everybody in it. The kids really didn't want to be split up and go to separate graduates from the same school. It's not kind of like college, where the College of Science and Behavioral Science or something. It's not the same thing.
Yeah.
So hopefully we got 1 year of this, and we can come back home.
Well, they started the renovations at Middle back in, before Christmas, so hopefully they'll be through with it by this time next year. Just a reminder, we said the 27th, 4:30. I also requested that we do nothing that night but schools, and from Ms. Jolly and Ms. Garrett and Community Care. However, obviously, if they have something that has to be dealt with, we'll have to deal with it, of course. But otherwise, we'll get right into whatever amendments you have, Mr. Sandvik, and you can get right into the budget discussion. Anything else from the committee for the director?
You go ahead and talk about the growth one. I'll let you.
If I may,
Yes, sir.
Mr. Chairman, one other late change that especially hurts about 6 districts across the state, 4 to 6. The governor, the total amount in the current year budget for growth is $27 million. In that last round of cuts, he cut growth to $15 million. We should get 3.2 million, we should be over 3. We might hit 3.5. We're having to budget basically half of that. for next year.
At the end of this year, sometime in
Yeah.
early June or so.
Yeah, we've got the
We'll
million
get going.
six.
Get a little bonus come in
Yeah.
that we have to just
Mhm.
guess at what it's gonna
Yeah,
be.
we anticipate at least the same growth, and in my revenue projections, I'm looking at half the revenue.
Since he cut
On
from
that
27 to
line.
15.
Yeah.
So,
Right,
They just sliced the pie up. That's
Yeah.
the way to manage it.
And that'll affect us this June,
No,
not,
next
or June
budget
of
year.
fif-
You
June
were all
of
right for
15,
this
then.
year.
okay, yeah. So that'll affect the end of next year.
May help our ending fund balance some this year is what you really
Yeah.
run into. Of course, we
We
use
pretty much had
about
it budgeted.
12 million on the ending fund balance
Yeah.
to make it balance this year. That's our
Yeah.
other issue with everything
Yeah.
coming into place.
Yeah.
A lot of scenarios are developing.
If you sent the committee and budget committee and health and ed committee, something in say May 1st, is that May 10th? I mean, what, if we could just get it a couple of weeks and keep the guessing, and I understand why it's necessary. I understand we're dealing with the state of Tennessee here. But if the less we could guess, is that possible, say 10 days before or 2 weeks before the 27th?
Sure, we could do that.
And that would be
very easy.
fairly
That's what-
accurate. I mean, we'll be dealing with probably pretty actual numbers at that point.
If he could get it in by the 15th, that's the commission meeting, he wouldn't even have to mail them, he could just have them in the boxes.
That's correct.
Yeah, we can do that.
We have 2 more budget meetings with the board and dealing with it. The revenue side is what's really
Yeah.
our unknown still at
We're
this
looking for
particular
miracles.
point. Cookie sales.
I'm glad you said that, you made me think of something I was gonna mention a minute ago. Matt Nolan, when he was here, he was talking about how great it is when the schools compete, and that's kind of helped, improve the recycle effort and all that. I wonder if there's not some kind of competition or something you can do to get everybody to take a week and shop local, or, I don't know what it would be, I don't know how you track it, I don't know how you design it, but, it's so easy to get kids excited about anything sometimes, especially when you make a game out of it. And I'm just wondering if there's not some way to do that. And even if everybody doesn't participate, the ones that do, maybe you picked up something you wouldn't have picked up, So I don't know, just a thought.
Hopefully people realize how big sales tax is.
Well,
for local
and May's a
counties.
really good,
Formulas.
I mean, it's late to do this now, but May is a terrific month to do that, because I know just being in, the retail world, May is my 3rd biggest month, behind November and December, because I have Mother's Day, teacher gifts, which is huge, and graduation gifts.
Okay.
So May would be a terrific month to do, and like I said, and maybe there's another time to do it, but for sure, November,
You own a
December.
liquor store, right?
I do not. If I did, I would probably have the money to give
Congratulations.
you. Yeah.
Well, we could also mention shopping online as well. And that revenue does not get to the Murfreesboro City
It's
Schools
the
or
dirty
the Rutherford
deed,
County
we all do
Schools.
it, but yeah.
Yeah.
And if they could possibly vote in the rural area, shop in the rural areas, there's more and more shops being opened all the time.
True.
That money doesn't have to be split with the cities that
Well, that's
close their schools. at.
one of the problems with the Laverne. We're right there at Davidson County.
Yes.
And the sales tax in Davidson County is a half% cheaper than what it is here. And why drive to Murfreesboro and Smyrna when you can drive right there to Antioch and trade the trade? That's the problem we have here in Laverne.
But Walmart's coming.
Yeah, Walmart's good.
Walmart is coming and
But
we
the
are
grocery
happy.
store is-
Plus, we had 2 ribbon cuttings last week on some things, and so that was good too. We've got some more coming.
Mr. Chair, if there are other bits of information you'd like for us to try to calculate or grouse or things that will help you or explain to you, we'll try to do that for you, just kinda
Anything
let you
else,
know.
committee members? If not, let's remind our citizens to vote. I voted today, my wife and I did, early voting. I think it goes on, and I know this
Till May
week, and
1st. Till May 1st.
May 1st.
tell me again, May 1?
May 1st.
You can vote May 1, and that's
That's the last day
It's
of
the
early
last
voting.
day for early voting. Okay, so get out there and vote. There's plenty of locations and et cetera. If
Voter's
it's,
card, ID card.
and it took 2 minutes today.
No matter who you vote for, just vote.
So,
And don't complain about stuff if you don't bother.
Oh, that is well put. Anything else, committee? Thank you so much for your input. We are adjourned.